Okay, good. Sense. If there's anyone that have questions, statements they want to make, you can raise your hand. The next time we come back, we're going to go into the cancers. We're going to talk about the autism. We're going to talk about um, autism, how nicotine can be used to reverse things like autism, how it can be used to reverse cancer, and then we'll show you the items that are used to completely inhibit venoms. Let's see here. Okay, cool. Okay, CJ, please unmute.
Great. Thank you so much, Brother Luke.
Yeah.
I can't tell you thank enough. Two questions. You had mentioned, and I'm not so sure how to understand it. You said when someone is, I guess, the sicker they are, the quicker the patch works, versus if someone is basically healthy and following it. Is that how that's a good way to put it? The sicker the person is, the quicker the patch works. Is that
No,
a
the
takeaway?
research show that folks that practice a healthy lifestyle, it takes longer for the patch to work for them than someone who does not follow a healthy lifestyle.
Okay.
Yeah.
Okay. All right.
So
And
you may find that a unhealthy person may take 3 weeks,
right.
while a healthy person may take 30 to 45 days.
Okay. That could be
For
discouraging, but I do
yeah.
understand.
But see,
And
no, once you know, see the fact that you know,
yes.
then in that way it would not be a problem now because you're like, okay, now I know that, just know that it's going to take a little longer, but it will happen.
Right. Right. Thank you so much. And secondly, I,
Yes.
I, I was the one that put it in the chat. So if you started off without having the proper understanding, which now I understand, and you started off with a 10.5, so and you're starting now with a 1 or 2,
Oh no,
where how do you
no.
graduate? How do you? Because
Did
now I
you?
understand today when you explained about the receptor sites not open up. I got it today. I got it.
When you use the 10.5, what happened to you?
Um, mm, mm, I'm not so sure.
Okay, then just come down to the 7. You can use 7 and you'll be fine.
Okay.
Yeah,
Okay. But if
you'll be able to.
I have someone, I guess, that I would like to, and I listened to what you explained to them about starting off someone gradual, you're not quite so sure, and
Well,
if
no,
they're
you remember
having
we
any
were talking
issues.
about pacemaker, heart
Yes.
problem, and so forth. So that's why we started down at those low levels.
And how do you graduate? Do you know, one milligram per after a month, after 2 weeks, after 3 weeks? How do
It
you, what's it?
depends. It depends.
Okay.
It depends.
Okay.
Everybody's body depends respond differently,
Sure.
but normally after a week you can check and see how the tolerance are. Sometimes it's after 30 days, sometimes it's after 2 weeks,
Thank you
but
kindly.
the first increase will take place after a week after you're
Thank
on.
you so much, Brother Luke. Appreciate you,
Okay,
sir.
you're
Thank you.
welcome. Chris George, please unmute. Chris George. Chris, raise your hand real quick again, dear. I was trying to remove CJ and I move you. Chris George, please raise your hand. Okay, good. Chris, please unmute.
Okay. Hearing me now?
Loud and clear.
Okay. Um, I don't think you could have said it any better. And I don't think you could give another explanation about the nicotine patch. I think it's so simple. And I think everybody by now should understand or have some kind of understanding about the nicotine patch. Although this week I was told that there is no research out there saying that the nicotine patch can do this or can do that. But I guess the person not researching at all, right? So this week I was having some issues with something. I was trying to get on to you, but I didn't get on to you at all. But I kept using the patch and I think I got some relief. But I think I need some more advice as to the issue I'm having. So I hope after this session I could speak to you tonight.
No,
Um,
tonight, no. Sister Chris, let me tell you, after I do these lectures, I need to actually
rest. Okay.
just calm down a little and come down a few notches because I kind of get hyped up to do them.
Yes,
So normally I'm exhausted after these sessions. So like
yes, yes,
tomorrow
yes.
is perfect.
All right. Okay,
Yeah.
cool.
And then, I can walk you through and see what issue you have and fix it up for you.
Right. And I just want to encourage everybody. I had a knee problem. And I tell you, I couldn't walk down any hill. I had to walk sideways to get down the hill. It was so much pain. And I kept using that nicotine patch for some months well, until one day I was going somewhere and trying to catch the bus. And I realized I run. And I was shocked. I said, but wait, I run. And then I realized I'm not feeling the pain anymore. Up to
Amen.
today, I get to work and I said, but wait, Chris, you run. Hi. So when I got into work, one of the ladies said, Miss Chris, like the knee give you a rest today. In my mind, I saying, but the thing working? I said, all right. And I didn't use it for the rest of the week. Up to today, this knee don't give me any trouble. Now and then I will find a little stiffness in it. And as I feel that little stiffness, I go and I put on the patch. And I tell you, I live by the patch.
Mm.
Right? So anybody who having any issues with any kind of thing, after the laws of health and your faith and your trust in God is a nicotine patch.
Amen.
Right? So that is my testimony today.
Amen. Thank you so much, Sister Chris. Sister
Welcome.
Vera, please unmute. Sister Vera.
Yes, happy Sabbath, everyone. Hello, Brother Luke. Excellent presentation as always. I don't think you can stop talking about nicotine because the message still has to get out. And nicotine is still so associated with tobacco, people don't understand the separation. But I like the way you did the vitamin C and the orange. That was like a visual. So I think that still has to get pushed. And even me, I jumped on it when I first heard it from you about the nicotine, how it helps with the COVID and to protect you. But this whole pain angle, I don't think I was paying attention to this part because I would wear the patch more. Because I just had the hip replacement. Um, my incision wound took longer to heal. It was like 9 weeks to it completely healed. And I haven't really been going to physical therapy because I'm a little nervous about being inside with a bunch of people and getting sick. But it's 3 months and my hip is not where it needs to be. So I'm definitely going to take that test. You're talking about try to patch more often. I'm still on 3.5. I'm going to see maybe a week or so. I'm going to see if I can go up.
Sister Vera, I remember when you first started, you were so skeptical of that nicotine patch. I am so proud to hear that you're at 3.5.
No, but you know what happened? With my type A personality, as soon as I heard you say it on the thing, I ordered it from Amazon. I probably tried it 2 days after I heard about it. And I started with 3.5. I felt good. But the next day I went to 7 and I had a reaction. That's what spooked me. So I was like, oh, wait a minute. Because I exercise and I'm heavy and I'm pushing my heart already. So that little extra 3.5, I felt it. So that's what scared me. But I accepted it as soon as I heard it because it made sense. And I did my own little bit of research about the receptor sites. And I know about the the cannabinoid receptor sites too. These are just receptor sites in our bodies that actually exist. But the nicotine is coming out more in a scientific arena, but not so much with people, like regular people. You know what I mean?
Yes. Go right
Yeah,
ahead.
yeah, because they still see it as cigarettes and tobacco and whatever. But I had an aunt, a great aunt. She used to chew tobacco. I'm pretty sure it was tobacco. And I was a little girl and I just seen her chewing and I actually was like, oh, what's that? Do you know that lady gave it to me? I was so sick. They said, what did you do? Why did you give it to the baby? What's wrong with you? Yeah, so I never liked it from them. But when I heard it, I was like, anything that's going to help reverse these symptoms. And I'm seeing a lot of, I have a family member who has dementia. And I'm trying to tell my cousin, to please try it. I mean, I'm gonna have to go over there physically and put it on myself because they act like they think they're gonna grow hair or something bad's gonna happen. Like you said, you're already bad. What do you have to lose? Her husband is now like an invalid, like somebody she has to take care of. And this is devastating. So, with the brain, and I know a lot of people with like slow dementia, it's part of the long COVID because you do see people still suffering, and it is COVID related. They may not be putting it together, but we know, and if we can intercede and step in there and suggest it, and sometimes we're gonna have to be a little pushy because I know I'm gonna have to be a little pushy with her because I already told her and I sent her the pictures and everything. So if I have to go over there and put it on, now I have to. It's gonna be a job. I'm gonna have to come every day, be like, okay, is it still on? But I just pray that it really works. I'm looking forward to it. I don't care what I have to go through. I'm gonna do it. So thank you for your presentation today. It definitely put a spark in me to do more. So I think, yes.
Sister Antoinette, please unmute.
Hello, good afternoon. Happy Sabbath, everyone. My background is gonna get a little noisy, so I had put a question in the chat.
Go ahead, sis. Oh, okay. Okay, so she's gonna put the question in the chat because her background is gonna get noisy. Okay. Sister Joanne, please unmute.
Happy Sabbath. Good afternoon, everyone.
Happy Sabbath, sis.
Although I wasn't high, I was on, but I just got on like about 15 minutes ago. But time I got to church today, just again, they announced a week before that he came out with a diagnosis, and he was signing me. He would like to talk to me.
Wait, Sister Joanne,
Someone
I
told
can
him
barely
about
hear
what
you.
happened.
Saints, is it me or is it Sister Joanne that we're barely hearing? Is it me or is it Sister Joanne?
Can everybody hear me?
Anyone on the panel
Hello,
can
can you
say?
hear
Or...
me, everybody?
Yes, it's Sister Joan.
Yeah, Sister Joanne, you're breaking up real bad. We can barely hear you.
Oh, okay, let me try again. Can you hear me now?
Okay, go ahead. We'll try and see if we can make it. Okay, I think we lose Sister Joanne. Sister Joanne, please raise your hand again. In the meanwhile, let me see if I can see the young lady's question in the chat. Let's see here. Okay, Sister Antoinette is asking, the mother has stage 4 ovarian and had 2 bouts of chemo. What would be a good nicotine protocol for her? It all depends, Sister Antoinette. How much does she weigh? You know what I mean? How much does she weigh? How tall is she? How much does she weigh? Give me an idea. Sister Camille says, I've lost my sense of smell for many years, but recently I started using the nicotine patch. Not even every day, but my sense of smell is completely back. Come on, saints, listen to that. Sister Camille says, I've lost my sense of smell for many years, but recently I started using the nicotine patch. Not even every day, but my sense of smell is coming back. Okay. She is what, 5'1", 5'2", about 142 pounds. I would start her, especially if you say she has. I start her at about 7 milligrams on that nicotine patch and see how she's doing with that. I would start her at 7 milligrams, just to let you know. Okay. I think I may have all the questions. Do I have all the questions? Yeah, that is a case study, Brother Patrick. 7 milligrams. That's correct, Sister Antoinette. 7 milligrams. Daily. 1 for 24 hours a day. Okay. I think that's all the question. Let me do this. let me see, one last question here. All right, cool. Can the nicotine patch help someone with seizure? It depends. It depends, you know, what's the cause of the seizure? You know, what's the cause of the seizure? Can someone who had head injury take the nicotine patch? Yes, they can, but I'll start them at a very low, start them at about 1 milligram and see how their body respond. And then we can gradually over time work that up. Someone said, do I need to take the nicotine patch for the rest of my life? Good question. As long as you're among individuals, look, Sister Zena, I guess you have not seen the research that is out there. Here's the research so you can understand, Sister Zena. Let me tell you what has to happen. It's either, listen good, it's either all the people who took the vaccine die, okay? It's either they all die, or everybody detox, or we continue using methods to avoid being shedded on. Those are the options. It's either all the vaccinated people die, and then even if all the vaccinated people die, listen to this, then we got to avoid the water system where they're putting venom in the water. And we got to avoid the foods that they put in venom in. We got to avoid the seeds that they put in venom in to avoid this issue from reoccurring again. Or we all detox, you know, or we just continue using methods to help us, to prevent us from getting sick. And we all cohabitate together, no problem at all. You know, I think that there are going to always be people who oppose the nicotine. So leave them alone. And they could be your family members, your parents, your loved ones. So you leave them alone. Just make sure you protect yourself. So in that way you can spend time with everybody without any problem and nobody feel kind of left out or feel secluded or anything like that. It actually reverses high blood pressure. Nicotine helps to reverse high blood pressure. What I would do if someone has high blood pressure, start off with the lowest possible dosage. If you can come in like maybe at 3.5 or even 2 milligrams or something like that, start low. Once the nicotinic receptors open, you can increase it to 3.5 and ultimately to 7 milligrams. And you'll be amazed to see how awesome it works. Okay. Someone says, my cousin is now down with pancreatic cancer, stage 4. I offer to help him to do a consultation with you. However, he has given up on himself after doing chemo for 2 years. Is there any hope? Of course there's hope for him. Of course there's hope for him. How to avoid water? Listen, if you have rainwater, you're fine. If you have water where they've not put venom in, you're fine. Can the patch help diabetic nerve pain? Of course. The nicotine patch reverses. It helps to reverse diabetes, and it helps to reverse neuropathy, which is the nerve pain. What about protection from shedding? It protects you from shedding. That's correct. That is correct. 6'3", arthritis, diabetes, increased prostate. Of course you should be putting on. Elder, you're supposed to have that patch on. You should have had that on long time ago. Long time ago, Elder. You should have had that patch on. Because let me tell you something. The patch even reverses type 1 diabetes. Says the thing deep that reverses type 1. It reverses autoimmune conditions. Says, Satan has been using this method for years. It's just that we never stopped to study it. It's because of the pandemic why we have gone over there and study it now. But he has been using it for years. The patch can definitely help with strokes, help individuals to be more cognitive and to reverse the negative effects of stroke. That is correct. Okay. I think I got through with all the questions there. Now, since let me add one thing. Since you see this topic is the most difficult topic for me to present. every time I present this topic, I get attacked. Since the other day I present this topic, all of a sudden, the electricity went in my house and the light just started flashing on, off, on, off. It's only by God's grace my equipments are still here today. Okay? It's the weirdest thing that has ever happened. Since we've been doing a teaching, my car has broken down so many times. And my car just broke down again a couple of days ago, and it's costing me about $1,000 to fix it. I'm gonna ask you guys, Saints, you guys gotta help Brother Luke. Give Brother Luke some donations that Brother Luke can go and get that car fixed because of this topic. Saints, you see this topic? This topic is a problematic topic. Every time I present this topic, since I have nothing but problem. Computer crashes, all kind of crazy stuff happen. I honestly believe that Satan does not want God's children to understand this topic because it helps God's children to keep a clear mind. So in that way, if they have sinned, they can ask God for forgiveness and be preserved for Christ's soon return. Saints, if the information has been a blessing, consider supporting the ministry. Help Brother Luke to get his vehicle back on the road from such challenging situation. Every time I present this topic, I have problems. I'm telling you guys, anybody who has been with me, they know every time we talk this topic, it's trouble. So I'm just telling you guys, Brother Luke is going to put a donation thing in the open Sabbath. Consider going over there and make a donation for me. Help me that I can get my car back on the road so I'll be on the road again. Amen. By God's grace. All right, so let me shut this down. Let me take I see 4 more last statements here. Let me just make sure I can answer those. Someone says, Brother Luke, it's being taught that 2 possible reasons nicotine is in plant: man's experimentation and Satan's invention. Okay, well, if you take it that way, Sister White loved tomatoes. So why would the prophet of God be using tomatoes that has nicotine in it? So Saints, do me a favor. All I'm telling you, don't listen to those extreme folks because they come and make these statements and they give you no solution. Now, Saints, if they make statements like this and they come with a workable solution, you don't necessarily have to believe everything they say, but if the solution works, you can use that solution. Okay? Don't let folks come and put information before you without a workable solution. Yep. Nicotine is in eggplant. It is in cantaloupe. Look, let me tell you something. Folks, let me tell you. Listen, someone went and told one of our friends here that it's man's experiment and it's Satan's invention. Absolutely not. Don't listen to those people. Don't listen. Let me tell you what to do. Let's study those individuals who make that statement and see if anything happens to them. Let's pray that understanding comes before anything happens to them, because you know the end result. You know where Satan is going. We all know where Satan is going with this thing. It's weird. When I teach this topic in the world, I get not even one objection. Not even one. Once it says, by the time I'm talking, I give the testimony, put up the research, I get 100% acceptance in the non-Adventist world. In the Adventist world, even though I gave the quotes and the spirit of prophecy and I explain all the stuff, I just get fight. So, but time will reveal. Time will reveal. All I'm saying, you just watch. You just watch. I don't know if you guys know, we had one of our big prominent ministry. The gentleman who run that prominent ministry, he's from Jamaica. He now has Parkinson's disease. If I tell you his name, you guys know, everybody on this thing knows the guy. Prominent Jamaican gentleman who lives in the US. Prominent. He has Parkinson's disease. And the gentleman was highly cognitive, travel all over the world, bring us all kind of present truth information. How did he get that? Is he shedding? Tell you, shedding is deadly. Is it a COVID-19 vaccine? It's deadly. That's all I'm saying to you guys. Just keep an open mind. But this gentleman, prominent gentleman, he now have Parkinson's disease. He's from Jamaica. You guys know him. If I call his name, you guys know him. He's from Jamaica. He has a Present Truth ministry. He travels the world, give us all kind of information, shows us the entire world. And so you can relate. When you read things in the Bible, he shows it to you literally. So it makes you believe the situation even more. Can a pregnant woman use nicotine patch? Of course. Not only can she use the patch, she can also use the gum. But she doesn't use that strong of a dosage, okay? All right, so let me close this. Oh, I guess there's somebody has a question. And then I turn it over to Brother Cook. Elder, I didn't know you're here. Let me see if I can find you. Sister Bailey, please unmute. Sister Bailey. Denise Bailey, Charles, please unmute. Okay, I guess it wasn't real. Okay, let me see if I see my buddy here. Brother Kenny, I'm wondering if you're here. I think you are, but I'm not finding you, Brother Kenny. Just raise your hand, Brother Kenny, if you're here. I don't know if you're on Facebook or if you're here with us, but okay, so let me close here down then, and we'll turn it over to Brother Cook. We need to bind satanic attacks days prior to each of the webinars. That is correct. Zoom, that is correct. Zoom, you can say that again. Zoom, please, 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 please.